This segment sponsored by Viking Psychiatry. Welcome back to Mental Health Matters with Viking Psychiatry. And joining me today is their owner, Sean Goddard, and we are going to dive into a new conversation regarding mental health. Hello.
Good morning.
Good morning. How are you doing?
I'm doing good. So good to be here again.
Good. Okay, so we've been talking about so many interesting things, diving into depression, and today we're going to talk about PTSD. That is something else that is really affecting the community at such high rates, right? Of course, people think first, veterans, PTSD from serving, from being in different experiences, but people can experience PTSD in many aspects of their life. So can we kind of start off by sharing about post-traumatic stress disorder and how it could affect normal people?
Yeah, absolutely. You're absolutely right. Typically, when people think of PTSD, they think of veterans and soldiers and war and those types of things. But PTSD can affect anybody at any point in their life, right? For example, I grew up in the system, right? We've talked about that and went through some traumatic events through that. So it would be expected that I potentially have PTSD from that. Just yesterday, a family member witnessed a semi-truck hitting a boy on his moped, and very much traumatized that person who was a witness, and it would not be abnormal for him to experience PTSD from witnessing this traumatic event. And it always doesn't have to be big explosions, right, or a semi-truck involved, right? How we are affected by a certain event can greatly affect how we process it and how that affects us long term.
Yeah, and what does the body do during those episodes or moments? Is it like the body and the brain is reliving a situation, and that's what makes it so traumatic? It's like, oh my God, this is happening again. And you have to kind of like overcome that all over again.
Yeah, we don't necessarily always relive the entire experience, but I'm from the West Coast originally, and there's something about the smell of pine trees for me that just causes me to relax and think of home, right? And so when I'm driving out in the country, sometimes, not in Oregon, but other places, and especially when it's raining, and I roll down my window and I get that scent, I just immediately feel relaxed and at home, right? And more centered, right? So the brain can do that for us on a calming and relaxing side, right? But at that same time, if there's a sound or a smell or a certain environment, can also cause response that isn't relaxing, right? That triggers more of the flight and fight type of response. And that's kind of what we see with PTSD, is that this event has set its hold somewhere in that brain, right? That certain factors can cause those thoughts and those feelings and that fear that you experience potentially to come racing back to the surface.
And then so up until this point, really, how has PTSD been treated?
Therapy is a big one. There's different therapy modalities that are available beyond just your standard talk therapy. For example, there's EMDR, RRT. There's a lot of treatment options that are available specifically to PTSD. As well, there's use of medications. And regretfully, there's kind of off-label uses that have been done that don't always lead to the best outcomes. Any meditation can be successful, right? Sometimes group therapies. There's different treatment options that are available out there, and new treatment options being studied that I'm really excited about as well.
Yeah, and I'm so curious if PTSD is similar to depression, where you have bouts of it, but you don't actually get over it. It's like you can go into recession, but you are not cured. Does PTSD have a cure?
The simple answer is no, but I definitely believe that through appropriate treatment patterns and effort on everybody's part involved in the care, that you can greatly minimize the effects of PTSD and not cause the emotional responses and triggers that can occur with it. So.
Yes. Okay. And so something that you offer in your office is ketamine infusions. So kind of give us an overview about what type of treatment is that?
Yeah, so ketamine, originally approved as an anesthetic medication, has been used in mental health for quite some time now. And one of the focuses we have, because I definitely want to help the vets and also people suffering with PTSD, is IV infusions. And so typically this involves coming in twice a week for 3 to 6 weeks, depending on the severity of the case that we're dealing with. And you're getting IV infusions. You're in office for about 90 minutes. And ketamine is a dissociative agent. And so what that means is you might not feel your toes, or they could be tingling, right, or not feel your feet, or see pretty colors, right, or kind of have a little bit of an out-of-body experience. And not everybody has that. What's important is the chemical changes that are occurring in the brain, and they're very rapid. And we've talked about so many times about how important it is to feel better and feel better sooner, right, because the hope that's involved with that. And what we've seen, we really push therapy in conjunction with ketamine infusions. I tell people all the time, we have this Pandora's box, right, where we've kind of shoved all the things that have happened to us in life, those events, and we try to keep that lid closed. And when we go into therapy and we try to open that lid, right, it can cause an emotional response, an emotional reaction, whether that's anger, tears, right, racing heart rate, sweaty palms, right, because we're pulling that back up. And what ketamine does, in my opinion, is it allows that box to be opened up a little bit more and a little bit more and a little bit wider without having that triggered response. And I have multiple therapists that I work with in Fort Wayne that have treated clients going through ketamine, and they all say that they experience so much more progression in therapy. I had one therapist that said it's like you gave him steroids, because we did EMDR for a year and we were only to get this far. And in the 12 weeks that he was treating ketamine with you, we went from here to here and just progressed so quickly. And that's what we want. A lot of times it's not just one thing by itself. Ketamine is not a miracle drug, right? It's not going to cure anything. But if we take ketamine and we use it appropriately, because there's a lot of misnomers out there about it, and then we take a successful therapy modality and we combine those together, we can just make amazing changes for a lot of people.
Yeah, and I know that amazing changes through PTSD, anxiety, but it also treats other things too, right?
Yeah, it's actually pretty amazing. Ketamine, when it's used, leaves no area of the brain untouched. And so if we have somebody coming in to treat PTSD, or let's say depression, most often than not, we often see other things going on, right? One of the first clients I had depression, anxiety, PTSD, and a severe eating disorder, right? And while we were trying to treat the depression with suicidality, in the grand scheme of things, we saw improvement in her anxiety, we saw improvement in her PTSD, and we saw improvement in her eating disorder, significant improvement in her eating disorder. And so that's the great thing about it, is that while we might try to focus on one thing for you, we often see improvements in others. And when you've done the same treatments, whether it's for depression, anxiety, PTSD, eating disorders, substance use disorder, alcoholism, and you've seen failure after failure, this is where ketamine can really make a significant impact and cause changes, because we're not following that same path. We're doing something different, and we're providing that hope that people want again.
Yeah, that's great. And hope is what we all need, for
That's
sure.
right.
And so last week we were talking about the knocks out and how that can be treated towards adolescents. And so with this ketamine infusions, is this specifically for 18 and older, or can adolescents also get this treatment?
Yeah, so ketamine is not FDA approved to be used outside of pain management and anesthesia, and so anytime that we use it outside of those two approvals, we are using it what's considered off-label. And so even if we're using it in somebody 18 and older, it's considered an off-label use. So there are clinics in the U.S. that do provide ketamine infusions for those under the age of 18. We have done some cases under the age of 18, but overall at our practice we do treat ages 18 18 and above at this time. There are more ongoing studies and just a recently great release study on ketamine below the age of 18. And the more data that we have and the more safety that we feel associated with that, the better off we feel at using it below the age of 18.
Okay. And this is something that is or is not covered by insurance?
It is not covered by insurance at this time, regretfully. You know, the hope is there that it will be one day, but regretfully our system is really pushed off of money, and ketamine is a generic medication, and there's no profit in spending money to get ketamine approved for depression or PTSD, and it's very expensive to get FDA approval on drugs. That's why like Spravato came around, right? But our hope is that we will see this approved at one point, and then insurance will cover it.
Yeah. Okay. Well, thank you so much for sharing today.
Thank you. Great to be here.
And if you'd like more information about Viking Psychiatry, we'll have their website listed below, and we'll be right back. This segment sponsored by Viking Psychiatry.